Hospitalization for COVID-19 doubles the risk of dying months later. That in a report at Study Finds, where we invite you to like and subscribe for the latest information. Needing hospitalization for COVID-19 is already a frightening ordeal in the short term, but a new study finds it could have an even greater consequence later on. Researchers in the United Kingdom have discovered that people needing hospitalization for a coronavirus infection are twice as likely to die or return to the hospital within the next few months. Issues range from persistent loss of taste and smell to kidney disease. Hospitalization may worsen a person's physical and mental health as patients experience memory lapses after being under sedation from medical ventilation and staying in bed for weeks or months on end. Researchers at the London School of Hygiene and Tropical Medicine looked at medical records from the database OpenSAFELY, which contained data on approximately 25,000 hospital patients discharged after COVID-19 illness in 2020. The team also compared this data to the medical records of over 100,000 patients hospitalized for reasons other than COVID-19. Results show people hospitalized for COVID-19 and discharged 1 week after had double the risk of hospital readmission or death in the next few months. Their risk of death from any cause was almost 5 times higher than the general population. When comparing to the flu, COVID patients fared a little better, having a slightly reduced risk of hospitalization or death in the future. However, when you focus on people needing hospitalization for their illness, the risk of death soared in the COVID-19 group. There was also a higher chance of requiring readmission and a greater risk of death from dementia among these patients. Find more detail on this and other studies at studyfinds.com.